Looks like we are live.
We're live. Where are we?
Yes,
Glenn?
we are. Hey, everybody. Glenn Haussman here. I'm with Anthony Melchiorri and Dr. Ronald Primas' office. Now, we're doing things a little bit different for those of you listening to our audio stream out there. We're a little format today, but we have breaking news reports. We really want to make sure that each and every one of you are informed about what's going on. So, Anthony, what's going on? Why are we doing this this quick turnaround show here?
Well, when I was first in the hospitality business, when I was in the first hotel business at Plaza Hotel, I met a gentleman named Dr. Ron Primas, and he was our house doctor. And he's actually a house doctor for a lot of hotels in New York City, and he's an infectious disease specialist. So when I put two and two together, I said, what's going on with the coronavirus and in hospitality and travel? Who should I call?
Right.
And I called that guy.
Ghostbusters.
Right.
Hey, Doc.
Hey, how are you?
How are you?
How are you?
Good, good. Thanks for having me on, gentlemen. I appreciate it.
Yeah, if I could get you come a little bit closer to the microphone, that would be great. All right, we'll be taking your questions out there, audience. So just put them in the comment box. Let us know what you're thinking. Understand there's a 20 to 30 second delay that might be happening. Plus, we got to wait until this pause in the conversation to work in your questions and your comments, but we will get to them. We know how important this issue is today. Anthony, back to you.
So, first of all, a little bit about your background, what your expertise is, and then I want to talk about how we met.
So I'm an internal medicine physician. My subspecialty is travel medicine, tropical disease. I do a fair amount of preventive medicine, which, not just for travel related stuff, but just general preventive medicine, of which travel is a subsection of. And I'm here in Manhattan and just love what I do. And yeah,
but you've been in and out of hotels. I mean, what people don't know is when I was a young manager in the hotel business,
Right.
3 o'clock in the morning, this gentleman would show up with his bag and he would go up to a room. 5 o'clock in the morning, 8
Right.
o'clock at night. I was like, I don't know when he ever slept. I mean,
I sleep when I drive home.
but seriously, like there's days like you're up at 4 o'clock in the morning, you're in the hotel helping people.
Yeah.
Right.
And you help everyone from the regular traveler to, we won't name names, but superstars.
Yes.
You have a lot of clients that are A-list superstars.
And kings and queens.
And kings and
Yeah.
queens. Well, he's a king and I'm a
And
king.
you're
And who's a queen? But so
I thought you were going to say I was the Joker.
But you've been around people that travel for many, many years, and people, when they come to you, they get really concerned because they've been in a foreign country, maybe they're not feeling well, and they get nervous. I remember there was one incident a long time ago, like 20 years ago. It was on the front page of the paper. You know which one I'm talking about?
Yeah, the bubonic plague.
Can we talk about that?
Sure.
So talk me through that.
So
You're allowed to. It's only been 20 years.
so I've been-
Right.
actually no, less than 20 years. 2002.
Okay.
It feels like 20 years.
Yeah,
Anyway,
2000.
bubonic plague
Yeah.
in New York.
So what happened was I had a couple that was staying at a local hotel, and they called me in October. Influenza season was not here yet, and they called me. They said, "We think that we have the flu. Can you check us out?" And I was like, "Sure, I'll come right over." But they were like, "No, we're in your neighborhood. Can we come by?" I'm like, "Yeah, I'm here." I was just doing some paperwork because it was still after 9/11, and New York was still just getting on its feet. The hotel industry was still,
Just coming back.
Yeah, just coming back. And, so again, I was here just doing some paperwork, and they came into the office, and he was confused when he came in, meaning he couldn't answer questions and so on. And he was sitting right there in that chair. And when he calmed down, he started to think clearly, and I asked him some questions, and he started telling me how he had some boil on his groin. And
Where did he travel to? Where was he?
No, they didn't travel. They were from New Mexico.
Okay.
And so bubonic plague is still around all over the world, and you still get but it's about 3,000 cases worldwide, quite a few cases in the desert Southwest because, prairie doors get infected. And so there are some people in the United States that get infected, like less than 10 a year, but people do get it.
Mm-hmm.
There is a vaccine for it. And so I examined him, and he had really non-specific symptoms. He had really high fever, blood pressure starting to bottom out a little bit. Came back into this, I examined him in that room. He came back into this room, sat down, I examined the wife. And when I examined her, she had a bubo on her thigh. A bubo is a lymph node that has a very specific color and just has a
I thought it was
distinct
a
look.
Star Wars droid.
Yes.
Is he close enough to the mic?
Yeah,
I just
everything's
wanna
going
make
great. Yeah.
Okay.
So anyway, when I saw her, I got concerned, and everybody's on high alert still. Then after the whole anthrax thing and all the bioterrorism possibilities that were there, and if you think that one person has plague, that's your antennas have to get raised. Two people constitutes technically like a pandemic, almost.
Right.
Just a lot of people, an epidemic. Because you shouldn't even have one, now two cases there. So you automatically have to think bioterrorism. So call the hospital, sent them over. They, of course, laughed. They thought there's no way this is happening.
I remember everybody was laughing about it.
And, isolated them. And sure enough, we sent off some emergency labs and tested positive, and that was it.
And did they survive?
They both survived this particular episode, yes.
Wow.
But didn't somebody get one of their arms amputated or something?
Both legs had to be amputated.
From the gentleman.
Yeah. So what happened was she got better pretty quickly within a few days of just being on intravenous antibiotics. He kept just deteriorating, and we had to intubate him.
And if they went to a regular doctor and just showed up, the regular doctor wouldn't have realized there was bubonic plague.
Not sure. A skilled physician.
Maybe. And so if they just went out into New York City without knowing, they would have contaminated many people?
Well, what happened was we caught them, thankfully, at a stage where they weren't contagious. Had they let it go a couple more days, and they got to the point where they developed what's called hematology, meaning it goes from the lymph nodes to the bloodstream to the lungs. And
Right.
Then it becomes a problem.
Pneumonic. Then it's an issue.
All right, so
Okay, so
Anthony,
I
I think we got to get right into this.
Right.
At
So
this-
I wanted to back up. I wanted to kind of just set
Yep.
the standard for who this gentleman is.
That's
and,
right.
And that he's an expert. So
before you get into the first question,
All
let me
right.
just say, hey, you guys are already asking great questions. I promise we will get to them, including great tips, what you could do to protect yourself and your guests. Stay tuned for that. But I think the most important place to start is understanding what we're dealing with. Right, Anthony?
right. So what's the first thing to know what's going on with coronavirus? What are the first helpful hints? And then I got some specific questions for you.
So the first thing you have to be aware of is, where is that traveler coming from? If they're from an endemic area, or they've been in contact with someone who's a known, what we call index case,
Right.
Your index of suspicion has to go up, and you have to be on kind of high alert, and call the Department of Health and
Right.
notify them that there's a potential case at your hotel.
So if you don't feel well and maybe you have a cold and you're just not feeling well, maybe even have a little bit of a fever, is the best thing to do is just stay home and see if you get worse? Or is it to go into an urgent care or to a doctor's office?
The problem with this particular virus is it's still an unknown. More than likely, it's a very benign disease. It does have a case fatality rate of calculated about 1% in the regular population. In extreme elderly population, they're at much higher risk of succumbing to it.
But if you get it, should you go to the doctor or stay home and just monitor yourself?
Yeah, I think that for most people, if you're not in the above 60 age category, don't have any history of pulmonary or renal disease, kidney or lung disease, then you're probably okay staying home. And if you start to kind of get worse, then get to seek medical attention. If you're over 60, or you do have heart disease, lung disease, liver, kidney, lupus, autoimmune, you should seek help at that point.
So if somebody in your hotel right now says, hey, I don't feel well, I have a fever, I need to see a doctor, what's the best thing for them to do?
Best thing to do is to either reach out to whoever your house doctor is and have them field all the questions and make a determination of whether the person needs to get seen, can just stay at home and take over-the-counter medication, or need to be hospitalized.
Okay. And one of the things we're hearing a lot about is there's not enough tests. Are doctors getting tests? So if I go to your office tomorrow, can I get tested?
Yes, the test was released on Monday, and the supplies are in tomorrow.
How are they able to turn them around so quickly?
The turnaround time on the test is going to be 48 to 70.
No, I meant, how do they create so many so quickly?
Oh, I mean, it's all trial and error, right? So
Right.
you have things that are in the pipeline already
Mhm.
that are for other viruses that they can check. There's PCR, ELISA, there's all the different tests that the models that they're
Right.
using, and they do DNA sequencing. And then what they do is they kind of fine tune it and tweak it to whatever the this new virus is.
Right.
And then what took long for this particular test is the first round of testing that they didn't live up to the standards of the CDC.
Right.
The new testing that they came up with is a valid test that's reproducible. It gives valid results, and so now we're going to have a test that you can say, yes, this person has it or they don't have it.
So now we're in the travel industry. You're in the travel industry, even though you're a doctor. It's what
Yes.
you do, travel medicine. What do you say to someone like, I have to get on a plane Sunday to go to California? Is it safe to get on a plane? Is it safe to go to a conference? And again, what's your opinion? I don't know if you're comfortable answering that. But.
I have to say, it's still an unknown. Every day we're getting new information about this particular virus. Again, I have to say with the same notion that if someone is in an at-risk category, it's probably best that they don't travel.
Right.
Certainly, I don't think that taking a cruise is a good thing because that's a hotbed.
Right. So this is this goes back to what John Oliver was talking about last week. We need to have some sort of judgment somewhere in in between, like wearing hazmat suits and licking subway poles or something like that. Right.
Well, I think for me personally, I'll just talk from my personal experience.
Well, you're old. You shouldn't travel.
I'm 54. You're a lot older than me.
So
that's not true. He's not. He's not. He's in a lot better shape than me, though. For me, I wouldn't right now get on a cruise because if somebody does have a fever, they're going to lock down that cruise ship, correct?
Right.
Correct.
Right. And I don't want to be on a lockdown cruise ship. I feel safe traveling. I feel safe getting on an airplane. Now, what I understand is they filter the air every few minutes on an airplane. So talk about that.
So what happens is all airplanes have a HEPA filter, and all the air on airlines do get filtered. The concern that we have is that if there is, again, I keep using the word index case. Index case means a person who is infectious at that particular time is sitting next to you, in front or behind you. So it depends on what your position next to an index case is. That's going to increase your infectivity rate.
And I do want to say that both Southwest and Delta, I got emails from them yesterday. Other airlines probably did this, but they sent out emails talking about how they handle their cleaning procedures all the time and the new steps that they're taking to ensure that their planes are safe. Doctor?
Airplanes are very safe. The few recorded cases in the past they've had of people who got tuberculosis or multi-drug resistant tuberculosis on airplanes, which is documented, was again specifically not because of the recirculated air. It's because they were in direct contact with someone else who was ill.
Mm-hmm.
But airline travel is very safe. A couple of caveats is, yes, the airlines do sterilize everything, but it's always best to bring some disinfectant wipes with you, clean off the headrest, clean off the armrest, clean off the touch screen in front of you. Clean off the tray table.
So everything
which I've done anyway.
I was about to say, and everything you see your OCD friend do under normal circumstances.
Which I do all the time anyway.
Right.
So you're doing. So I give you my blessing to travel, my friend.
Right. Okay.
Excellent. I have a question in terms of whether or not you are scared of travel. It was geared towards me. I've been to a lot of places lately, and I have a lot on the docket right now. I personally am not scared to travel. I don't feel that it's going to be a problem for me to travel. I'd be a little bit more concerned about my mom traveling, not me. Anthony, how about you?
Absolutely. Like, grandpa, our grandpa is 83 years old, and I wouldn't be putting him on a plane. He doesn't fly anyway, but if he did, I wouldn't put him on a plane. I think it's common sense, right? I think it's like anything else. It's you have to use your common sense. But there's a word that people are throwing around that I think is scaring people, and it's the word pandemic.
Right.
And pandemic isn't what it seems. Pandemic seems to be something I thought initially was something like just everyone's dying, everyone's getting sick.
And that was an 80s hair metal band.
He's so not funny. Even on a live LinkedIn broadcast, you're not funny. So explain the word pandemic.
So pandemic means when you have a large amount of the population that's infected with something. It doesn't mean that everybody's going to die. All it means is that a lot of people that are at risk are now infected and infectious and can spread it.
Right. And it means really because it's global pandemic, meaning that it's basically found on almost all continents except Antarctica.
Right. Well, although I have to tell you, if you look at the map right now of where the cases are, you can see how this is probably going to end up being seasonal, right? So you can see there's really not much in Africa. There's really not much in South America, and there's not much in Australia.
Because they're warmer climates.
Well, because they're in their summer season right now. The same thing like influenza, right?
Right.
So we have our influenza season. When we get into our summer and we have less influenza that's here,
Right.
The Southern Hemisphere will start seeing increases in their flu cases. I see influenza cases all year round because I'll see tourists that come in from Australia or South America, and I'll test them even in July and August, and they'll be positive for influenza A or influenza B.
Right.
So it's seasonal. But if you look at this, until every single continent has a significant amount of population that's affected, you can't really call it a pandemic just yet. The World Health Organization keeps throwing that around, that they're about to say that it is, but can't really.
Who? Sorry.
Yeah.
World Health Organization humor there.
But again, even if they do use the word pandemic, it's
not yet.
Right, but even if they do use that word,
it's
not the end of the world.
It's not the end of the world.
Okay, so one of the questions that we're getting here in the audience, and yes, we will get to what you can do at your hotel soon, but right now we're talking about traveling before even people get to your hotel. All these conferences are getting canceled right now, right? There's a couple that are holding the line. Others are canceling. They say out of an abundance of caution. Is it a good idea to shut down conferences and events and all of that stuff?
I'd have to say at this point, yes.
Mm-hmm.
Only because of the fact when you have a large amount of the population that's in one area that's all congregating together and in close quarters, it would be a good idea to prevent the spread of this.
Right.
So that ultimately our elderly population that we have to protect is protected.
Right.
Right. So let's say you go to the conference, you get a little bit of flu, you get cold symptoms or whatever, and you go home and grandma or grandpa's at home. You're now going to put them at risk. Right. So in order to protect everybody else, you want to wait until this particular wave passes, and then.
Right. It's like if you wouldn't go to grandpa's house with the flu, right?
Right. Mm-hmm.
Same thing.
Yeah, it's like
there's a conference I'm going to. I'm sorry to interrupt you. There's a conference I'm going to. I just got off the phone with the organizers that I'm going to in the end of March, I think, and it's still on. It's going to be in Florida. And it's still on. And the question was, are you okay with shaking everyone's hand? And I'm like, let's see what happens by the end of March. So I'll say hello to everyone, but I'm probably not going to go in the crowd and shake everybody's hand. Like when I saw you just now, we did elbows, right?
Right.
So,
so the Corona bump.
What's that? The Corona bump? How about the foot bump?
We should do a TikTok video, the Corona bump after this. Yeah.
So, listen, I think what we're all saying is use your common sense. What other questions we have?
All right. So people do say use your common sense. Not sure. That's the problem, is that some people don't use common sense. Yeah, exactly. Which brings us back to what you said with some of these big events that are happening out there. All right. So let's get a little bit into what hoteliers can be thinking about and doing. Now, earlier in the conversation, Doctor, we had posited a particular scenario. Someone in your hotel is feeling ill. Say someone in your hotel is feeling ill. You've come across it. You recommended they talk to that doctor. But what if that doesn't happen? Should you think about quarantining that room? What are the procedures that you should take if you're suspicious?
So
there's two types. There's two people that you have to be concerned about, right? So one are people that decide to self-quarantine, that say, oh, I was at a conference and someone got sick. I'm deciding to stay in your hotel, which economically, I don't know what's going to happen. Who pays for the room if they decide to stay there for 14 days, right? So that becomes a big issue. But if someone is sick, they still have to be quarantined. I would inform engineering, housekeeping, and food service, and let them know that there is a sick person in the room, and take proper precautions. Meaning, if they're going to deliver food, for example, they should leave the food outside.
Right.
If someone is self-quarantining and not ill, the food service staff and engineering and housekeeping can go into the room, but it would be a good idea if
Why
they wear
should they?
masks, gloves,
Right.
wash before and after. It's also a good idea to leave a trash bin outside the person's room so you can dispose of the stuff.
Well, wouldn't you be worried that if they're have this and they're blowing their nose and stuff, and
No,
all
no,
that's in the trash and it's in the hallway?
no. This is for employees that go into the room.
Okay, right. Mhm.
So for people that are in the room that are sick, then yeah, I would red bag everything just
Right.
in case.
Okay,
So
that's an important distinction.
So if I'm on the 4th floor of a hotel and I'm quarantining myself because I don't feel well, and I have the fever and I'm sick and I'm in the room, what's the chance of the guy next door getting my virus?
Unless there's communication between both of them, or if there's a common source, meaning like
A connected room with a little vent underneath the
no,
door?
that wouldn't do it.
Okay.
You have to have physical contact, right? So if housekeeping goes in, they don't do proper sterilization technique, and then they go and they fix the next room. That's the only theoretical way that you can transmit to the next room. But being on the same floor, is probably not a risk unless that particular person touched like the elevator knob or the door handle or the wall. And
What about if they touched a kiosk check-in unit? People just ask, would you use those right now?
well, this is a pet peeve of mine for like a long time, even at airports, at the those little check-in terminals. They're really, really, really infectious. I mean, I'll see people go to the bathroom, not wash their hand, and then go out and like use it. It's crazy. So I always said that I wish I could be smart enough to come up with some kind of
Right.
thing to.
Yeah, you're right.
carry
As a
with me.
matter of fact, a major fast food chain has been installing electronic ordering systems, and everyone tested had fecal matter on it.
Yeah.
So probably
Really?
probably as a matter of just
Well,
good judgment, you should think twice about using
I,
those things.
I think there's a novel, not novel Chrome, but there's a new kind of high-tech gadget that they're working on. I think in Cleveland Clinic now, specifically for this purpose. That happened even before this particular outbreak, for people that register in the hospital, in the clinics, for example, and they have some kind of ultraviolet
Scanner?
it's like almost like a scanning thing. It comes down and it just sterilizes the screen after each use.
Oh.
Yeah, which was
That's
cool.
what we
So
need.
That's pretty cool.
They're working on some kind of template.
And it's almost,
for that,
and it's
so-
in a couple
and
of years,
it-
that'll probably be completely normal. I don't use those.
Right.
And and I just wash my hands a lot.
I go up to the people. I like that customer service myself. Plus, I like helping with creating jobs. Doctor, I want to get into back to that hypothetical patient. They've left the room. They've gone home. Now, what do you do with that room?
You have to, Clorox actually has been shown to completely disinfect this and kill the virus. The virus, I mean,
The doctor does not own any Clorox stock, just so you know.
okay.
Bleach.
Bleach, right.
Yeah.
So the thing is that, to go in and they're still trying to figure out exactly what the lifespan of this is on a desk or an inanimate object. That's called fomite transmission, right? And so the estimates are anywhere from a few hours in some studies to days. So again, the data is still out on that, and they're still collecting data to find out how long it lasts.
And that's the reason, if I can interrupt you, that's the reason people say to me, why is everybody making a big deal? Why
Right.
is everybody freaking out?
Right.
It's because there are still unknowns.
right.
Like if you knew that this died on contact and the only way to get this is like basically kiss somebody on the lips, then I think people wouldn't be as panicked. But right now, we don't know if you touch a doorknob 2 days after somebody else touches it, if I'm going to get infected. And I think that's once we understand that, I think things will calm down.
Right. I mean, I still think that you have to have proper precautions, almost like what we did back in the days with HIV. Just assume everybody has it and just, go ahead and just clean
Right.
every room like you would if someone has it. The doorknobs, the elevator buttons, the toilet seats. One thing that actually I learned from your show a while back, two things. One is the remote control is filthy, right? So that completely needs to be sterilized. I would not use a remote control. We use we usually take the
Plastic towel
bag
cover or
out of
something?
the ice bucket
And
and
use
kind of use that. That's fine. The other thing is some standard decor in the room, like the throw pillows, the throw blanket. We never put on there. I
No.
mean, that's something that
The
hotels.
flushometer too. The flushometer is the most filthy thing because think about it, that's the thing that people touch before they wash their hands.
Right. Okay. So,
So-
now that we've established there's lots of filthy surfaces, what about the fact that you have people coming and going within your hotel every single day and you need to take precautions? Now, I noticed here you have the PURL. You ask people to use it before using any surfaces. Plus, before this this broadcast started, I used the restroom. They asked me even after I washed my hands to still use the PURL.
Before and after. Exactly. You don't have any stock in Purell, right?
Oh, dang, I should have bought some. That was a great chance for me to plug it. But
Okay.
yes, hand disinfectant.
Right.
So, but like,
Hand sanitizer.
like,
Hand
right,
sanitizer.
like right now, housekeepers are going in and out of these rooms.
Right.
What should they be doing? What should they be wearing?
So they don't need masks. That's been proven unless you're directly in contact with an index case with an upper respiratory issue. The masks are overkill. But clearly, like, washing hands and putting gloves on, and then washing hands after the gloves are taken off. That's important.
But how about like somebody? I'm skeeved out when I ask for extra towels or sheets, and they bring them with their bare hands. That skeeves me out. So if somebody comes and they have their bare hands and they give me sheets, and maybe they're infected, can I get infected with those sheets?
First of all, an employee who thinks they may be infected should not be working.
Mm-hmm.
They should self-quarantine at home and not come in.
They should, but if they get paid by the hour, maybe they might make the choice not to. Then what happens?
Yeah, it's potential. Again, there's a lot of unknowns. It's probably unlikely that you would get something that way, but it's an emerging disease, and we have to just kind of feel it out and see how it is. But more than likely, no, you would not get.
You're not a fortune teller, I don't think, anyway. But where do you think we are 2 months from now with this?
I think it's going to all blow over.
When? Can you have a time and day?
Probably by May.
All
By
right.
May. So it's going to be here for a little while.
Okay, so another question from our audience. COVID transmission still happens while in the incubation period without showing symptoms. Is that correct?
That's correct.
That is correct.
Say it again. What's the question?
COVID transmission still happens while the incubation period, even though there are no symptoms showing. So considering this, how should hotels be protecting their customers against the transmission from the hotel to employees? So I'd like, just some more reminders about what you could be doing. I love the idea of maybe having that hand sanitizer right next to the desk. Oh, welcome to the hotel. Use that hand sanitizer. Let's talk.
Which I find most hotels are doing right now anyway, which I think is really good. Almost everybody's adopting the same protocol.
But give us some protocols just in case that particular hotel owner is unaware or hasn't had the opportunity to provide these things.
Pure at the desk, if you have mask available and someone's coughing, you ask them to put on a mask because that's actually been shown to reduce the transmission as well. Or, you'll have some people that are not courteous that will keep coughing and not cough into the elbow. You just be polite and ask them, hey, can you just step back and,
So how about if you see somebody that is coughing and looks obviously sick, can you ask them to either stay in their room or leave?
Again, it depends on the situation, but yeah, I would address it just for public safety. Yeah, I would go up to them and first ask if they're okay, right? Because you want to be concerned about their well-being. And then you want to also be concerned about the well-being of your staff and the other guests.
And one of the things that New York City is asking is for people to stay off the trains. Does that make sense?
Train is a hotbed of, a lot of communicable disease.
Yeah, I mean, there's millions of people that are on it every day, right?
So I think that's probably a good plan.
Okay.
Another question. I'll get past the compliments on my salmon sweater, by the way, and go straight to does
Nothing about my black blazer.
does basic Lysol spray from the drugstore kill the virus on surfaces? Basic Lysol type of spray. Yes,
it does.
Basic Lysol spray kills this pathogen.
Right.
Okay.
Have there been any people that have called you and or panicked and freaked out and like not specifically? I'm not going to give names, but how are people handling it? I mean, you're smiling, so I imagine the answer is yes.
A lot of my celebrity patients are calling me and freaking because they do travel a lot, and plus they have a lot more visibility, so they have a lot more at stake, and so they also they tend to be more concerned about their health than other people.
Mm-hmm.
So
because they don't work, they don't get paid.
Right.
Well, but like most
a
people.
lot of them are concerned. A lot of them can't wait until I get the test in tomorrow. A lot of the walking well will probably be in here or me doing house calls to test them and send it.
Mhm.
So feel bad for the lab because the lab's going to get inundated, and most of these specimens are going to be negative.
Mhm.
Yeah, of course. But I
So-
think, all right.
Better safe than sorry.
So should I test myself or shouldn't I, unless I have symptoms?
If you have not been in contact with anybody and you have no symptoms and you have not come back from an area that the disease is spreading, then
Such as China or Italy.
right, South Korea.
Yeah,
right?
but now it's spreading. It's spreading in the states, spreading in New York, and New York's the #1 state in the country that is having these cases.
We also have there's a lot more people here than there is in other
Anywhere
areas, and we're like the host to the world, right? Everybody comes to New York,
Mhm.
so it's still not any reason to panic. In most cases, it's a pretty benign, self-limiting illness.
So if someone got it, how long would it last until they feel better?
So there's no antiviral for it yet. I'm assuming that they're probably using with drug discovery and artificial intelligence. We'll probably have something by the fall. The vaccine is probably about a year out, but we will at least have something to fight it with. But without
Right.
treatment, you're looking at probably being, depending on your immune status, probably about 10 to 14 days of feeling unwell.
And can it Dayquil and Theraflu, can that help?
It'll control the symptoms. Best thing to do is actually, this is a perfect opportunity for people to stop smoking, right? Because if you smoke, clearly you're going to have a lot worse of a time with this than other people. There are some people that they're seeing that may have permanent scarring of the lung and get damage. So if you're a smoker, more than likely you're going to probably be in that demographic. So stop smoking, try and eat a balanced, healthy diet if you can, and try and exercise. Just the healthier
Right.
that the host is, the healthier the person is, the quicker you'll get better.
And again, common sense. So Sean Worker, who is asking, just listened to CNBC's Closing Bell, and the CEO of JetBlue commented that their air supply is filtered at operating room levels. Very interesting. But doctor, what's your view of air quality in hotels in general?
It's the same as any other indoor building, right? If you're in an area with high pollution, you're going to have high pollution in the hotel. If you have a hotel that's in the countryside, and you're not going to have as much pollution. But the risk is the same as any other domicile, like your home or any other building.
Yeah, and somebody just wants to know, but I think the answer was we don't know how long the virus lasts on surfaces such as linens and stuff like that. They came in a little bit late into the broadcast.
It's about 14 days, right?
Yeah.
10 to 14 days.
Of how long someone's getting sick, or how
No,
long
on like surfaces like linens.
I think they maxed out from what I've read, max is like 3 days.
Okay.
But some of the studies show that it only lasts a few hours.
Right.
And again, it also depends on the topography. It depends on the type of surface that you have, right? If it's a marble slab or a piece of flat wood like this, it's probably going to die quicker, right? If it's something that has like some fenestrations in it or some texture to it, it's probably going to last a bit longer on a surface like that because there's more surface area.
Right. This person was specifically speaking about bed linens, but to go back to the example with Anthony getting the linens handed to him, a very, very low chance in your opinion.
Very low chance.
Are you going to a restaurant this weekend?
Yeah.
Okay.
Aren't you?
Yeah, I am. I'm actually getting on a plane this
taking
weekend.
me? Oh, okay.
No, I can't.
Yeah,
Yes,
so
of course I can.
And I hope to be on a plane this weekend as well to go to a major hotel industry event taking place, which they are saying will happen. I'm going to go and be sure to support them.
My paleo conference was scheduled till July. I was supposed to go in April.
It was canceled,
Postponed.
postponed.
Yeah, I don't like using the word cancel.
Okay. And how about I like to play poker. A good time to go play poker at the Borgata or somewhere else?
You know what? Again, if you're sharing cards and you have foamite transmission and someone else has it,
Not a good thing.
I know a lot of people from China do like coming over and playing in our casinos.
Yeah, it's hurting the bottom line of
might
the
not
major
be
resorts.
a good idea.
Yeah, but you can't get in now. I mean, from China, you can't get into this
Yeah,
country.
I'm a little concerned about there's so many surfaces there and you touch so many things there. You have to be very vigilant
Chips.
if you're going to go to
Right.
that place. I'm not going to say that you should not travel. I'm not going to say that you shouldn't go to any hotels. I want those companies to have some economics viability. Just use caution out there. But another thought, we talked about when it gets warmer,
Right.
the disease typically abates. Is there a particular temperature, like over 50 degrees for 3
not really.
days?
I mean, some studies came out showing that it's not so much that the as temperature dependent, but it's when it's cold out, people tend to congregate indoors, right? So anytime you have mass gatherings, you're going to spread it more, right? So, so if it's nice and it's warm out, you're going to go out, you're going to go for a walk, and there's not going to be that many people around you coughing in small, close quarters, right? So the warmer it gets, the more you'll be outside in nature, which also is healing. And
So just I want to back up because I want to make this clear because I get this question a lot recently. You get a call, your daughter doesn't feel good. She's at home and she has a little bit of a temperature and she has a cough, or your son or whoever, your friend, and they're under the age of 60 and they're relatively healthy. Do we immediately take that person to the doctor, or do we just watch them? And at what temperature do we get worried?
So I think watchful waiting for someone who's not at risk would be prudent. You have to be concerned if temperature goes above 103.
And then if it's 103, do you bring a person 103 into a waiting room and infect everybody else?
I mean, you have no choice. Well, again, if it's 103 and then not stable, yes. If it's 103 and you're concerned, you just have to keep being more vigilant and watching them a little bit closer.
Right.
If you have 103 and you're 80 years old, yeah, you're going to the ER.
Right. Well, what about if you're not 80 years old and 103? Should you go to the ER? Because my concern is all of these emergency rooms are going to get flooded with people. They'll be paralyzed. They won't be able to help the people that actually need it. With all these urgent care centers open, maybe that's a better place to go.
Again, it depends on how sick the individual is. If someone has severe short of breath, if they have what we call air hunger, if they're almost fainting or passing out or dizzy or have obvious signs that they're not doing well, then yeah, clearly they need to go to the hospital. But any other kind of garden variety upper respiratory infection with fever can probably be handled as an outpatient for sure.
Right. Great. Ooh, I don't know if you guys heard that on the microphone, but there's we're right on the street in New York City, so there are definitely
Welcome to New York.
City people happening.
So, Doc,
yes,
is the world coming to an end?
Hopefully not.
So you're not overly concerned about this?
I'm not overly concerned.
Okay,
In fact, I was all geared up for my paleo conference, and they just sent me the email saying that they rescheduled,
and you would have went.
I would have gone.
Okay,
absolutely.
All right, I think that's what's important to know.
The good thing is, now that some people are canceling their trips, the hotel room I wanted opened up, and I was like, all right, I'm going. I booked the hotel room and everything, and now they pulled the conference.
And they pulled it completely.
Yeah.
All right. So I think this seems like a good place to wrap it all up. Doctor, just once again, could you just summarize everything for us so people have an accurate understanding of what's going on right now? We don't need people to panic. We want people to be level-headed. We want people to have common sense. If you could just tie it up into a nice bow for us, that'd be awesome.
So main thing is, first rule of thumb is never panic, right? Panicking doesn't serve anybody any good. Second, you want to use prudent judgment. If you have someone who is not doing well, who is over 60 and just unwell, you want to get them treated. If they're under 60 and unwell, just watchful waiting and observation unless they deteriorate. Prudent personal protective modalities like frequent hand washing, using a hand sanitizer. There's one study, I think they came out showing that if you drink a lot of water, if the virus for some reason is in your mouth, if you drink water and it gets in your digestive tract, you can probably, like, the stomach acid will kill it, provided that, of course, you don't have an underlying stomach issue and that you're not on a proton pump inhibitor or one of those things that suppresses your acid.
Right.
And again, it's all about hand washing and just prudent precautions.
Great. Anthony, any final thoughts?
No, thank you, Doc. I
you,
appreciate it.
gentlemen.
And
Appreciate this.
so can we start with our last question that we usually ask on our podcast?
Sure. Let's make things a little bit. Let's end this show with a little bit of a levity out there, right? So
So on our podcast, we ask everyone, tell us something we don't know about you. So tell us something that we don't know about you. I know you're a health nut. You work out and you eat really well. So
I'm a fish nerd.
a fish nerd?
Yeah.
What does that mean?
like what? Yeah.
I was a marine biology major in college, and so I keep micro reefs, and I'll show you a picture of it after. But I spend a lot of my time pimping that tank out and using, of
Nice.
course, not wild caught. All my corals are propagated. All of my fish are captive bred. So we have sustainable, what we call mariculture.
So if I go to your home, which I actually was your house about 18 years ago to get a fly out of my ear.
I remember
It's a long
that.
story. And I would see
on a Sunday.
on a Sunday. And I had my two little girls. First time I'm showing them how to garden. And all of a sudden I got a fly in my ear and they start banging my head to get the fly out. I call him up. He goes, whatever you do, don't stick anything in your ear. I stuck something in my ear. I came to him. He goes, there's no fly, but you punctured something.
Nice. Good move.
But and that was like 18 years ago. So if I go to your house, there's a beautiful aquarium.
Small one, yes.
Small one. Okay. So tell us something we don't know about you.
About me. Well, you already know I was going to keep it with the the fish nerd thing, but I'm a fish nerd too. But everybody knows that. Not those kind of fish. The band fish out there. So let's. When I travel and people take their shoes and socks off next to me in the airplane and stuff like that, it takes all in my life, all the energy I can to not yell at those people.
I think there should be a federal rule that the flight attendant can go and bash them in the face with the suitcase.
Right. I think so.
Because if you take your shoes off, that's one thing. But you take your socks
it's
off,
disgusting. And then
right
they go
next to me?
they go into the bathroom.
It's
and then
gross.
It's disgusting.
Well,
and
they're walking on urine, right?
yes, right.
Isn't that a song? Walking on urine.
I was going to say Great Pretender song, which would be
Which, by the way, can I throw one more thing in?
Sure.
If you are gonna travel by airplane, one thing to do is to try to not sit anywhere near a bathroom. If you're going to book your seat as far, whether you're in first class business or regular,
Great.
book far away from where the bathroom is, because most people that are ill are going to congregate there. So the bathroom is also a hotbed of germs.
Oh, that's good to know.
Not necessarily thinking about the
'Cause
bathroom itself, but the people hanging around the bathroom.
Hanging around in the
There's a
bathroom.
higher potential.
Because
Right.
it's funny when I fly, I'm always in the first row.
Yeah.
I like the first row. So I'm flying Sunday and I will not be taking the first row.
Just
Thank you, Doc.
don't sit near a bathroom, buddy.
But
All right,
that's a great,
All right, so Anthony,
that's great.
tell us something we don't know about you.
What you don't know about me is I love the hotel business more than anything in the world. And one of the things that I realize, people ask me all the time, they're like, why the hotel business? Because you could do anything in the world in the hotel business.
Uh-huh.
And I didn't know there were doctors that did house call and they were called hotel doctors. I didn't know that. And I actually met someone before I met you. We were introduced by
Glenn Horowitz.
Glenn Horowitz.
Glenn Horowitz.
He was the house doctor for the Plaza at the time. And then one day he was on vacation and you came in. That's how we met.
Right.
But so I was fascinated that there's something called the house doctor for hotels, and I didn't realize. And they were relatively, it's not cheap, but it's not, it's not what you would think it would be.
Well,
It's affordable.
It's about a third of the price going to an ER.
Yeah.
Yeah.
And
the comfort of your own home.
right.
So.
And then, I'm going to tell a story. Okay. This is the
boy.
last time me and Doc saw each other.
Okay.
This is such a true, great hotel story with a hotel doc and a hotel guy. Okay, I may have told you the story. So I call him up and
I'll
say,
just
hey,
pretend I haven't and laugh at the right places.
so I call him up and say, hey, Doc, I just got out of the gym and I'm seeing stars. I went to my urgent care and they have no idea what the hell I have. And he goes, come see me. So he said, meet me Sunday. Do you remember this?
At the Four Seasons.
Meet me Sunday night. This is only going back 2-3 years ago.
Right.
Meet me at the Four Seasons. Sunday night, I have to examine someone. I think it was a prince, actually.
Right.
And when I'm finished with him, I'll come down and I'll check you out. So he goes to the front desk after he checks out his patient. Goes to the front desk and says, hey, do you have a place? I gotta give an exam to this guy. And the young lady said, okay, Doc, why don't you use our safety deposit box?
Yeah.
So I went into the safety deposit box and got a full examination by the hotel doctor in the hotel with the hotel guy.
Is that the whole fist talk?
And because of the doc, he sent me to the cardiologist. The cardiologist sent me to a surgeon cardiologist, and they saved my life. And I had a surgery because I had I had a flutter, and I had a what else I have? An AFib.
F.A.C.P.M flutter.
Right, I had a F.A.C.P.M flutter. I had all kinds of flutters, and saved my life. But where else would I get inspected besides the Four Seasons safety deposit box with the hotel doctor? Where else would I get inspected?
Although the best story is when a hotel guest wanted me to check him out because he had an STD, didn't want his wife to know.
He had what?
STD.
Oh, okay.
STI. I'm sorry, they changed the terminology. STI.
Okay.
And I had to examine him in the house car.
As you like drove around the block.
And he had it?
He thought he had it. He didn't. He was worried well.
He worried well.
Yeah.
Okay. What does that mean? He had it?
Meaning he cheated and thought he had something, but he really didn't. So he was panicking.
Okay.
I hope he learned his lesson.
He did.
You think?
Well, he never came back.
I would imagine you get a lot of that.
I have some people come back on a regular basis for that, no matter how many times I read them the Riot Act. And, it is, believe it or not, statistically, it is the second most common travel-related illness that I see is sexually transmitted disease. Second most.
Wow.
Really?
What's the most?
Gastrointestinal, upper respiratory.
Right.
And,
Wow.
Because people travel, their guard gets let down. Sometimes a little more alcohol involved than usual, and it happens.
Wow, interesting.
Equally in women and men, believe it or not.
Really?
I believe it.
Yeah.
Well, that makes sense.
Yeah.
That's how they have sex, men and women.
not
always. So, isn't that a funny story?
That was funny.
I wonder if they have that on film, me being basically fully naked in a safe deposit box.
They show it to every new employee as part of their training.
But okay, so
saved your life, buddy.
Yeah,
that's
all right.
right.
So doctor, if people want to reach out to you and find you, how can they do that?
So my website's travelmd, like medicaldoctor.com. And then if you want to reach me by phone, it's 212-737-1212.
Wow.
Thank you.
Right. And if you call me, maybe I'll give you a cell. No, I won't. But hey, if you come to New York and even if it's not the coronavirus, just in general, you're not feeling well and you need a doc, there's nobody doc in New York City than Dr. Primas. So thanks, Doc. I appreciate it.
Great. How do we find you online?
Anywhere you want to be on the internet at Anthony Hotels.
Great. And I am at Traveling Glenn. I want to thank all of you for watching this very special LinkedIn Live checking in broadcast. And of course, if you're listening to this in a podcast version, thanks for listening to that too. If you have any more questions or concerns, just drop us a line. I'm at Traveling Glenn. He's Anthony Hotels. Like our Facebook page, follow us on LinkedIn, all of that kind of good stuff. We're here to answer all your questions about this issue or anyone out there. And until next time, so for Dr. Primas, Anthony, and myself, Glenn, thanks for checking in.
Thanks, guys.
See you guys next time.
Be safe.